Government spokesperson and deputy head of the Prime Minister's office, Mme Thipphakone Chanthavongsa, highlighted the need to further follow Prime Ministerial Order No 15/PM on the reinforcement of measures for the containment, prevention and response to the COVID-19 pandemic.
พวกเขาสามารถควบคุมการระบาดได้ในระดับหนึ่งเฮ็ดให้ตัวเลขผู้ติดเชื้อภายในประเทศลดลง
Speaking at a media conference in Vientiane on Sunday, Deputy Head of the National Task Force for COVID-19 Prevention and Control, Mme Thipphakone Chanthavongsa, said although the number of new community-acquired cases of COVID-19 has declined over the past few weeks, new clusters continue to occur around the country. The government is concerned about the increasing number of cases occurring in neighboring countries, which poses a strong threat and a high risk of a major outbreak in Laos. In light of this, the government has extended the lockdown for another 15 days until July 15, with some restrictions continuing and others being lifted.
ต่างหน้าคณะเฉพาะกิจจึงขอเรียกร้องมายังบรรดาท่านดังนี้ 1. ขอให้คะแนนการและอำนาจการปกครองทุกขั้นตลอดฮอด
Mme Thipphakone urged everyone in Laos to comply with the government's guidelines, strengthen their solidarity, and join the government's battle against COVID for the benefit of the nation as a whole.
นับทั้งคนต่างประเทศที่อาศัยอยู่สปป.ลาวจงสามัคคีเป็นน้ำหนึ่งใจเดียว
She said Lao nationals and foreigners in Laos need to be honest and responsible and obey the laws, particularly those relating to COVID prevention. The government welcomes comments from members of the public and will apply useful suggestions to the battle to address the COVID crisis. Vientiane has been under lockdown or partial lockdown for more than 2 months since the first community outbreak of COVID erupted in mid-April. The government is aware that the lockdown has had negative impacts on the economy and people's livelihoods, but says restrictions are essential to keep the virus in check. On Sunday, 32 new cases were recorded, bringing the total number of COVID cases since March last year to 2,244. The new infections were identified after 1,717 samples were tested. Deputy Director General of the Department of Communicable Disease Control, Ministry of Health, Dr. Sisavat Sutatnilasai told a press briefing. Of the 32 new cases, 2 were reported in Vientiane province and 1 in Salavan province and are believed to be community acquired. In addition, 3 cases were reported in Khammon province, 9 in Savanakhet and 19 in Champasak, all of which were recorded among Lao workers returning from a neighboring country. No new cases have been reported in Vientiane for 5 consecutive days, but authorities remain concerned about the possibility of a major nationwide outbreak due to the surge in new cases in neighboring countries. On Friday, 32 new cases were confirmed, with 3 people testing positive for the highly infectious Delta variant of the virus. On Saturday, 37 people were reported as having the virus after 1,392 samples were tested. Worldwide, more than 184 million people have contracted the virus, with the death toll exceeding 3.9 million. More than 168 million people have been discharged from hospitals.